Sure, I'd be happy to. So UCB is a global biopharma company that's based in Brussels, Belgium, and we have a US headquarters in Atlanta, Georgia. And we are focused on developing new and transformative therapies for patients with severe neurological and immunological diseases. And we've been working in the epilepsy space specifically for over 2 decades. By way of background, I'm a clinical neuropsychologist by training, so my specialty is in the assessment and diagnosis of neurological diseases that affect cognition and behavior, such as in epilepsy. Well, we have 3 products currently available in epilepsy, depending on the clinical background of the patient and the type of seizures that they're experiencing. First, we have Briviac, which is approved for the treatment of focal seizures in patients who are ages 4 years of age and older. And it's available in multiple formulations depending on their clinical status. So as a tablet, oral formulation, or IV. We have a second anti-seizure medication, Vimpat, that's also approved for the treatment of focal seizures in patients 4 years and older. But it's also approved as an adjunctive therapy for primary generalized tonic-clonic seizures in patients 4 years of older and in adults. And then lastly, we have an intranasal benzodiazepine Nasalam, which is approved for the treatment of acute intermittent stereotypic frequent seizure activity, which is a mouthful way of saying acute repetitive seizures or seizure clusters. And this is an intranasal device for patients who are ages 12 years of age and older. Well, epilepsy is the 4th most common neurological disorder. And in the United States, that means there's about 3.4 million patients with epilepsy. What we know right now is about 1/3 of those patients continue to have severe and disabling seizures despite access to multiple different therapies. So while there's been tremendous advances in the care and management of epilepsy and the availability of new treatments, when you have 1/3 of patients still suffering from a life-threatening condition and seizures that can't be controlled, that tells us we have a lot of ground still to make up. Well, our mission first and foremost, Rob, is to transform the lives of patients. So we've been focused on developing therapies that control seizures, reduce the number of seizures that patients have. But it's our aspiration over the long term to get at the heart of what causes epilepsy and causes these seizures. So ideally, we want to develop solutions and therapies that change the course of disease for patients. In addition, we want to work with technology, data sources to best identify the solutions that fit individual patients. So to do this, I think one of our approaches is really to partner and co-create with the epilepsy community, advocates within that community, and of course, the practitioners and specialists that practice epilepsy treatment every day. I would just say that I think the last year has been a challenge for all of us, and it really highlighted the impact that a global healthcare crisis, a public healthcare crisis, can have on patients that are in need, and how important it is for all of us to move forward and lean in terms of developing new technologies, new ways of working, advances in telemedicine that are going to help serve these patients going forward. So we look forward to any opportunity to partnering with people in the epilepsy community.